Hello. I brought my mother to see Dr. Stephen Ferguson. She was absolutely in a really bad way. She couldn't get out of bed. We had to actually lift her out of bed, lift her into the chair. And Dr. Stephen Ferguson had...
So you said to me that she didn't come to the clinic that day, you thought she was going to die or something. You didn't think she'll make it, yeah?
Absolutely.
And what was happening with the ambulance and stuff? What were they saying?
The ambulance wanted to take her into hospital. They said that she had to go in straight away because they've never seen anything like this before.
Go on.
Where the person had just had sudden not being able to move. In fact, not even be able to turn herself in her own bed.
Yeah, and then what were they saying? Was you not allowed to go in with her or something?
That's exactly what they were saying. They were saying, oh well, we'll take her, but you cannot come into the hospital with her.
And why didn't you send her? What
oh no, I definitely wouldn't send her. After listening to Stephen Ferguson, Dr. Stephen Ferguson, on the radio, Galaxy Radio, and just knowing him on a personal level, I knew that definitely Stephen would be the place for me to bring her.
Yeah. When she first came, she had high blood pressure. How's her blood pressure today when we measured it?
Her blood pressure is perfect.
And then she had diabetes on the first day when she came.
She had diabetes, high blood pressure.
And how's her diabetes today when we measured it?
It's very good. It's 7.
All right. And then you were saying that what about like sort of dementia sort of symptoms? How's her like thinking and her dementia?
Absolutely.
Can she have a conversation now?
She can have a very good conversation now. She takes instruction. When she first came here, she wasn't taking very much instructions.
That's right.
You know, Stephen.
Yeah. So what about you said she was in a really bad state when she first came, and then in comparison to how she is now, what difference have you seen?
Well, the biggest difference is when she first came, we had to bring her in a wheelchair. She couldn't walk. And today she actually's got her spring in her step. She walked through, making a big conversation about it and saying how very nice the doctor is. So it's a really, really good, you know. And in fact, she's got on her clogs, and she hasn't worn those clogs for good part of a year.
Why was that? Because of her feet was...
Because her feet was really swollen, so she couldn't get her feet into any shoe whatsoever. So we actually brought her in her socks and slippers.
Yeah. So what about yourself, Edith? How do you feel in yourself?
Which one? You. How
do you feel?
Oh, good.
Yeah, it's good. Yes. Are you glad you came to the clinic?
Yeah.
Yeah. So would you have rather go to the hospital, or are you glad you came to do it naturally and natural things?
Come to the clinic.
What about the tablets and things? Would you like to take the hospital tablets and things? Or are you not into that kind of thing?
They give you a few sometimes when you go, not much.
But do you like those ones, the tablets and things?
I don't like tablets.
You don't like tablets. All right then. So would you say it's one of the best things that you've done for your mum, like bringing her to the clinic?
Absolutely, one of the best things. I would tell anybody to come to Dr. Ferguson, because your mother, your father, your friend, anybody, they will get better.